Throughout the video series, you'll meet several of our health and wellness experts who share their expertise to improve the mental health of our customers and patients. So Dr. Jon, thanks for talking with us today as we kick off our video series, and today particularly talking about mental health crisis in America.
Thanks for having us. It's a really important topic that we've got to go through. We've been seeing a lot of it. We thought coming out of the pandemic that you'd see kind of some of these things in adults and kids kind of start to die down, but anxiety, depression, and those things have remained really strong as the pandemic kind of wound down, and here we are.
Yeah, so when you look at statistics, the people in their 30s and 40s have suffered from the pandemic. Before the pandemic, the numbers were about 30% of people had a mental health diagnosis, and now those numbers are up to 45%. And in fact, our youngest adult, those under 34 years of age, have suffered the most, and up to 50% of those people will have a diagnosis.
Yeah, immediately coming out of the pandemic, we saw folks who were struggling from anxiety, whether it was with return to work policies, things like that, and getting their foot back in the door. Most of them are able to transition pretty nicely. We've seen a lot of those stories kind of play out on the front lines in primary care.
Yeah, so we know from experience that there are treatments for mental health, particularly anxiety and depression. You know, we know that counseling helps and medication helps, but another area that really affects people's mental health is sleep. So tell me a little bit about how sleep affects mental health and sort of things you can do to help.
So sleep is really a main driver in maintaining people's overall health, obviously, including mental health. So we like to see people getting approximately 7 to 8 hours of sleep every night. Less than that chronically tends to exacerbate people's depression, anxiety, as well as even other advanced psychiatric conditions. Unfortunately, anxiety by itself can sometimes impact people's sleep and make it harder to get that. Overall, you really have to start working on developing good habits around sleep. So that's turning off phones, tablets, not having TVs in your bedroom, so that you're not having blue light stimulation, starting to really develop routines, starting to go to bed at the same time, waking up regardless kind of what your day looks like, builds healthier sleep habits, and then really starting to develop a routine that when your day is coming to an end, you kind of start to calm down and transition into that sleep period. It really makes a difference, and by getting more adequate sleep, you're going to be less susceptible to really struggle with your mental health.
Well, Dr. Jon, thank you so much for talking with us today about sleep and mental health and those things we can do to decrease anxiety and depression through sleep. And again, thank you very much.
Thank you.